Speech Disorders by Nora Bramald. So I have decided to do my presentation on speech disorders. I've narrowed it down to oral motor disorders just because there is such a wide variety of speech disorders, and the methods of treatment, the causes, and all the specifics vary depending on what the actual disorder is. So the definition, what is a speech disorder? Typically, when we look at speech disorders, they can be lumped into two categories, and that would be receptive versus expressive. So receptive would be the understanding of language. So does the child understand the words that they hear? Are they able to follow directions? Are they able to understand books and just understanding language in general? Expressive would refer to the verbal aspect of speech. So when they verbalize, when they talk, can they pronounce words? Typically, children with expressive disorders will have really good receptive understanding of language. However, they struggle to verbalize their thoughts. Is it a disorder or a delay? So there is a big difference between a disorder or a delay. When we look at a delay, children who exhibit a delay will usually still be progressing normally to what is developmentally expected. It's just that it's a little bit delayed. It may be happening later for them, so they may not reach their milestones at the typical onset of other children, but they're still kind of progressing normally. A disorder is when children can kind of be all over the place, so they aren't meeting their milestones in a specific order that we see with other children. So there may be kind of bouncing around, or they may kind of skip certain skills. So typically, with a delay, so sometimes a delay will not need treatment, whereas a disorder almost always needs some form of treatment for the child to progress. And again, we're referring to oral motor. So what is the cause of oral motor speech disorders? So we don't really know what the cause is. With most children, there doesn't seem to be a reason for it. However, obviously, speech disorders and oral motor disorders can be related to other neurological impairments or other disorders such as autism, Down syndrome, a brain injury. And then, of course, we do have extreme cases where it is a result of abuse or neglect. But typically speaking, there is no known cause. Risk factors. So the risk factors seem to be low birth weight, associated with a preterm birth, a family history of speech disorders. So if a family member in the immediate family of the child has a speech disorder, it seems that it is more likely for that child to have a speech disorder. And then again, it's injury can cause like different types of brain injury, or again, association with other childhood disorders such as autism. Protective factors. So we know that children do better and improve when they are in a loving, supportive, non-critical environment. So parents who support their children through the disorder will definitely have improvement. Access to play and learning, and playing with your child and spending time with them and helping them through it. Access to books with lots of reading, and again, support from parents. Access to speech therapy resources, medical care and treatment, which again is not something that all children have access to. many of the free programs. Later we will talk about the one for my area, which is Grandview Children's Place in Pickering. There tends to be a very long waiting list to seek help. So that can be anywhere from 6 months to a year. So that is definitely not ideal for children who have speech disorders. You can also get private care from a registered speech language pathologist. But again, it's costly, so it depends whether or not the family can afford access to those services. Another important protective factor is that children show most improvement when parents can continue daily speech practice with their child. So once they seek help from a speech language pathologist, they will usually create a plan. And if the parents can practice that plan with the child daily in a fun, positive way, those children tend to do a lot better than children who are not practicing daily. Age of onset. So signs of oral motor can be seen in early infancy, such as a lack of babbling. Babies are often described as being very quiet and not making a lot of noise. And we can also see difficulty with breastfeeding, such as achieving the latch. However, it is not usually made clear or diagnosed until toddlerhood or even preschool age, or again, for a lot of children, until they start kindergarten. It becomes more clear when we kind of see that those developmental speech milestones are not being achieved. So a little bit more about oral motor disorders. So here I just kind of posted a graphic which refers to apraxia, which is one type of oral motor disorder. So children with oral motor disorders typically know what they want to say. They have an excellent understanding of language. The issue occurs when they try to speak. The connection becomes scrambled and the brain has trouble directing oral movements of the lips, tongue, and jaw to form the sounds that make up that word. They also may mix up the syllables in a word, so it can be very difficult for others to understand what the child is trying to say. Symptoms: little to no babbling as an infant, delayed speech, understanding language but having difficulty or inability to verbalize, difficulty with mouth movements, which would be oral motor movements, such as making the O shape with lips, difficulty with tongue placement. Infants may have difficulty with breastfeeding. Choking can increase as children lose placement of food in their mouth. Difficulty with pronunciation of sounds and sequencing to make up words. Children may feel isolated, embarrassed, or have low self-esteem. Behavioral issues as frustration at not being understood increases. So again, we mentioned here the increase of choking. So it has often been explained to me by different speech language pathologists who I've worked with that it is almost like the mouth is in space. So it's kind of like this big mass area and it's difficulty knowing what is where. So food, tongue placement, lip placement, it's almost as if it's lost in space to the child is how it's been explained to me, which is, I find, is a good way to visualize it. Prognosis. The prognosis also depends on the child's unique circumstances and what the cause is, but children do tend to make large improvements in speech when therapy is started in early childhood and a consistent schedule is maintained. So again, we talked about that early on. This is why it's very important to have access to the right care, and why it's not ideal to have really long waiting lists, because the sooner therapy is started, those connections in the brain can still be changed, and children seem to do a lot better when the therapy is started early on. And again, with speech disorders, it is very important for the therapy to be consistent because the single most effective treatment is the repetition of constantly repeating those words and sounds. It starts to build the pathways in the brain. There is a higher chance of having reading difficulties for children with speech disorders, so they may need support throughout their school years. So that's something to keep in mind too. Treatment. The best course of treatment depends on the child's unique needs, but usually includes therapy with a registered speech-language pathologist, consistent daily practice of the therapy plan. So again, tons and tons of repetition. Engaging games and activities that work on specific skills and sounds. Methods such as prompt and the Kaufman treatment kit. So here I've included a picture of the Kaufman treatment kit, which seems to do really, really well for children with oral motor disorders or apraxia. Speech language pathologists that I've talked to, most of them tend to use this program, as well as prompt. Prompt is a method where they kind of use touch with their fingers to help shape the mouth and direct placement of the tongue and lips. But again, that depends. Some children are not really receptive to being touched in the face. So for those kids, prompt isn't an option. But for children who don't mind those physical cues, it can be really, really helpful. And then again, here, how we mentioned games and activities, it's really, really important that treatment be very positive and that children are interested and engaged. Otherwise, they kind of shut down and progress is not really made. So even though we're talking about constant repetition and daily practice, we're doing this through games, through activities, through toys, and we're kind of sneaking the treatment in there. It's not really, unless it's with older children who you can kind of say, like, we're doing homework time and we're going to practice. It's especially with young children, it's really much more beneficial that you kind of hide it in play. Local resources. So again, I mentioned earlier on Grandview Children's Place. So this is a center in Pickering that is covered. So if you receive a referral from your family doctor, you go on the waiting list and then you can receive care from a speech-language pathologist, and they have different groups and different plans depending on your needs. But again, the downside to this is that you will likely be on a waiting list, which can be up to a year. The second thing that varies per family or for child is that you have to go to their center. So for some children, they don't do as well in therapy if they're kind of going to a center or a hospital. They may not be as comfortable. Whereas having a private speech-language pathologist, many of them will come to your home where the child is most comfortable, and especially when we're working with really young children, this can a lot of times be a really, really good option because the child is comfortable in their home environment. So the therapy, they may be more engaged in the therapy. And again, I mentioned family doctor. Family doctor is a good place to start in trying to obtain a diagnosis and to kind of share your concerns and figure out what path you should be on. And again, early years centers are really, really helpful because they have qualified early childhood educators. They have different programs so your child can play in different groups, have access to different activities and stories, and they can also help you with different ideas on what you can do with your child to help them.